Singapore will set up a new Communicable Diseases Agency as the Health Ministry restructures itself to tackle future pandemics better. Measures to strengthen hospital capacity also underway. These plans are revealed as a two-day debate in Parliament on the country's response to COVID-19 came to a close. Sherlyn Xia has more.
From large-scale swabbing exercises, strict contact tracing, and having patients quarantined in facilities, to supporting the population to self-test and recover safely at home. These responses involve the efforts of various agencies, and the Health Ministry is consolidating them all under one big umbrella.
The individual-centric clinical approach versus the population-based public health approach, they are actually not mutually exclusive. In fact, they complement one another, and we adopted both during different phases of COVID-19 pandemic. We should institutionalize both sets of capabilities for the long term and able to deploy both with flexibility and dexterity in future pandemics.
This is where the new Communicable Diseases Agency, or CDA, will come in under the Health Ministry. It will oversee all things surrounding disease preparedness, prevention and control, as well as outbreak response. MOH's restructuring will also see a permanent crisis strategy and operations group take up roots. First established to oversee all COVID-19 related operations, it will now be retained on standby for future outbreaks. And to augment manpower, MOH will set up a healthcare reserve force, training ex-healthcare workers and volunteers who can step up during larger surges.
With these changes, MOH will be organized to place greater emphasis on both clinical services and public health. They require different instincts, considerations, capabilities, and skill sets. Both are important and critical and will be institutionalized and built up within MOH.
To strengthen hospital capacity, MOH plans to make transitional care facilities a mainstay in the medium or long term. 5 of such sites were set up during COVID-19 to serve stable hospital patients waiting to move back home or to nursing homes. Mr. Ong says these proved to be very valuable and were as good as adding 500 beds to the acute hospitals. These TCFs will now be retained, with a new one set to open in the West in the coming months.